So, everybody, this is Kirsten, and I'm with International Health Consulting. I will be your moderator for today's call. And I'm really excited that we have our first webinar for the Global Employee Health Consortium this year, especially as we have a new interface with a fresh new website and new enhancements. So you have seen that through the communication that you received so far, announcements, and as you can see here, this is the new interface. It's a fresh new look and new design. We've created the possibility for social interactions, the discussion forums, and of course the archives. Access to past webinars. I think is always useful to go back and dial in, see what was said. The new YouTube channel where you can view past webinar snippets and also request full download access. So just some enhancements that we really thought were worthwhile and a good idea, responding to some comments, feedback, requests from you over the last year. So we're very excited about that. But of course, we're especially excited about building or featuring really exciting content and case studies over the year, as we did in the past few years. Across the globe, as usual, we'll feature different regions, different countries, different challenges, which most of are faced with on a daily basis. So that's really the goal. I know we have a lot of repeat episodes, but I know a few newcomers too. So I'll just, as usual, just briefly say what the Global Employee Health Consortium, or GECCO, if you will, is all about. It's a global thought leadership forum. It was created to assist organizations that are looking to improve health and enhance performance of employees worldwide for competitive advantage. So you'll see this theme coming up over and over again, because that's really the essence of the entire consortium. So that's our new interface, and as usual, please provide your feedback to anything, the format, but of course content, what you like to see featured, regions, topics, and so on. That's always very useful for us putting these webinars together. So we have two agenda items today, and really our main key feature is case from Quintiles, global company, and I'll get into that in a little bit. But we have Quintiles and the case study. I'd like to present a few slides on the benchmarking study on global approaches to health promotion. Many will be familiar with the annual survey on health promotion and workplace wellness strategies, which is driven by Buck Consultants, but also in conjunction with WeLife and also International Health Consulting and others. A lot of you have participated in that, and we'll have a new one coming up in the spring. I think it's a good time to announce this, so we'll get some communication on the new survey. But what we last year, what I worked with Betty Hall at Buck Consultants, is to look at really closely at some global practice leaders. So in this state, you have companies from all over the world, large, small, in different industries. But for this particular research, we approached multinationals who have a good track record in workplace health promotion. So we came out with 13 different employers, some US-based, some European-based. We talk about, well, how do you do it, and what is your approach? How do you run your programs, and what do you measure, and what are your drivers, and how have you been able to succeed? Because all the companies have had some success to varying degrees. Now, while this study is not published yet, and the analysis is not ongoing, I'll give you a little sneak preview in terms of some trial news, but I think it's really interesting what was kind of surfacing out of the analysis. So here you can see, this is from the annual survey. The question was, is your strategy global? And the multinational employers in the survey, the majority said yes. So that is, even though, of course, there's room for interpretation. What does global mean? It's interesting is that I already believe they do have a global health promotion strategy. And let's see from the slide, you can see growth. So 4 years that the survey has been conducted, we see a jump from 34 to 54%, and I think that's pretty interesting and pretty impressive, actually. So I think that kind of reinforces what we are seeing. Or for those of you who are kind of involved in global promotion, you know that there's growing interest from amongst at least national employers to globalize their workplace health promotion programs. That's really encouraging a definite trend that's out there. This study, we really wanted to look on more of a qualitative study. So we didn't look at specific comparative data points as a service, but look at some specific insights, specific practices from organizations that really have made progress. That was our goal with this survey. Now, again, this is just going to be a sneak preview, so just a couple interesting slides here. So we start out with, again, asking about some business drivers. And I think, no big surprise, business goals and also the issue of individual and personal performance is high on the agenda. And that reflects the survey findings were in productivity or reducing presenteeism, kind of more on pretty much most of the world. So that enforces that. So I think that's good, or interesting at a minimum. We have a couple of quotes here. We show improvement in health tied to business improvements, and I think most of you are probably familiar with that and are trying to do that too. But at the time, we have a number of companies which really make a point to emphasize at least the professionals that we interviewed, which were mostly physicians or HR professionals who kind of responsible for the program, just like you. We're saying, pointing it out, emphasizing, well, it's really about health. It's optimal health for employees. That will eventually drive the business results. So that's not business or ROI or what have you. It's not the first thing for us. It's actually health. So optimal health. So I think that's interesting here, and that's I guess how it should be. Now, in terms of challenges, I think I don't want to go through all of these because for those of you who have spent time on this, are pretty well familiar, and there's no big new ones here. But the challenges, just quickly here, global standards, trying to push through or implement global standards is always a challenge in terms of health promotion. You have the cultural aspect, the diversity is a big communication, regulatory environment, different over the world, and again the resources issue, finding good programs, finding good professionals who the programs. I think you're well familiar with that. But I did want to focus on some highlights here because I think it's always interesting to feature some quotes and what some of these companies said to bring to life. So in terms of actual, we asked about terminology too, which I think is on one hand really important, and the other, I don't want to spend too much time talking about terminology, which you could spend time actually implementing the programs. But as you know, well does not translate well everywhere. I know it's a widely used term, but in some countries, especially in German-speaking countries, it means a little bit different thing. So, just to give you the quote here, some like to call it health and well-being. I think you're aware of the term well-being being becoming very popular over the last few years. Health and wellness, or healthy people. So many terms that are within our vocabulary. We'd like to someday have one term that's used globally, but we're holding back today because we don't want to force anything yet. So I think that makes sense. While having the urge or the intent to have a global term, you want to push it too strong across the globe and work with the countries with their names. So there's kind of balance of branding and then also looking at some cultural issues. Another one: certain countries in Europe are still challenging. Germany, Switzerland, Greece, etc. Buying into the concept that an employer should be involved in employee health, because it's still difficult for them to embrace. All healthcare system in those countries, the question is raised: why work on this when it's already offered by the national healthcare system. So I think for those of you, global programs and working in Europe, I think you probably encountered this, likely encountered that for employees or even managers, employers of the local sites feel that, well, this is more of an issue for the national healthcare system or something for the employee themselves. So not so much an employer goal, but that still persists, I think. Finally, the last quote from the slide, the level of enthusiasm and engagement is higher in countries where the concept of workplace health promotion and related programs are newer, for example, in Asia or Latin America, compared to countries where it has been around for a while, in North America and Europe. And you will probably have seen that too, especially, I think, in some of the Asian countries, the excitement level and the willingness to join is well, at least can be very high. So some of the highest participation rates come from this, especially, I think. And I think that's understandably, given the newness and if it's presented as a benefit and so on, I think it makes sense. Okay, so moving on, just in terms of recommendations, again, I don't want to go through all these just for the sake of time, and we'll a more depth, analysis or presentation on the analysis once it's completed. But I think you will recognize some of these who have been implementing a global program. I think the link to the business aspect and then to your management is key. You want to be a solution within business. That's very, very, very important. Identifying common issues around the world and work with those, I think is good, is important, and that's becoming easier days because there's a lot of commonalities, I think, in health risks and challenges around the world, even with the cultural differences. Finding global standards. There seems to, amongst the 13 companies that we interviewed, that's definitely, I would say, one view that some kind of global standard should be created, drafted, and then implemented. Of course, these companies have different levels and different degrees of these standards, but there should be some kind of overall global arching guidance and principles. And this population, of course, very key. Some admitted, making the mistake of thinking that they knew it already before actually interviewing your local population, and making a long-term view and commitment. And in today's business world, it's always a challenge to have that and to do that. But I think very important with our field, I think, with health promotion. And then again, in terms of bringing it to life, I thought this one was really interesting from one of our participants. Quote, would strongly recommend having regional medical directors. They're viewed as advisors, counselors, and enablers. But the set of corporate folks not having arms and legs within regions is a disadvantage. And you've encountered this yourself too. Of course, not every company has medical directors. They have medical staff in the local regions. But it drives home the point having some kind of local representation staff, the HR too, who are viewed as advisors and counselors and so on. Sometimes, again, if you want to go to Europe, especially, the view towards, say it is US-based one, the view towards the corporate headquarters sometimes could be a little bit skeptical. Let's put it away. So people on the ground who actually drive it, doesn't have to be in every single country, obviously, because that may be difficult. But to have one region, I think, is very, very important, and they're looked at as kind of as a trusted advisor. So for this company, that seems to work very well, I think. So just wanted to make that point. So okay, so I think just again as a sneak preview for the benchmarking analysis, and the report should be coming out in the next 2 months, I would say. So look forward to that. And again, keep your questions to the end, because just for the skill here and keeping time, we will take your questions after the 2 presentations, and then we can get into discussion more. So we'll have time for that. So let me hand it over to our friends from Quintiles, and we will have 2 speakers. We will have Skye and Jacqui. Anne is the global wellness manager. She's in North Carolina in the U.S. and Jacqui is the Associate Manager of Employee Wellness in EMEA and is based in the UK. And I think I can say that Quintiles have done a lot of good work in terms of driving the global program. So I'll hand it over to, I think, Anna start.
Yeah, great. Can you hear me? So, okay, great. Okay, well, we're going to go ahead and I can advance slides here. Barry got me driving.
Again.
So very happy to be here and to share a bit of our story and hopefully generate some great Q at the end, which we always look forward to. I'm just going to take a few minutes to set this and let you know a little bit about Quintiles, and then pass it over to Jacqui, who's going to give you some more of the specifics and how she's really been engaging local HR and other aspects of our company to really drive wellness in her region. Who we are and what we do. We're a service provider. Our customers are in the pharmaceutical industry, and our people are really our product. We have over 24,000 employees in over 60 countries. And our employees are scientists and clinicians, product managers, statisticians, medical writers, and we have a large commercial division that has its field-based sales force. And these characteristics, being that our employees are very focused and deadline-driven, cross all kinds of time zones and spans, and work on multicultural teams, very passionate about their work, and also is really great. However, it does provide us as wellness leaders with quite a barrier to engagement because we do very hard at trying to attract attention from the employees away from their work to focus on themselves, and that can sometimes be quite a challenge, as you find as well. Our wellness program dates back to 2006, and I was involved in its inception. We used the CEO Cancer Gold Standard accreditation as our model for launching our wellness program, and that allowed us to really develop a comprehensive and evidence-based program that was very much initiated and supported by our senior leadership, which are two really key pieces we feel. And also, we've not had the burden of having to prove an ROI internal to our company. Our leaders look to the external benchmarking, data and the literature that leads to believe that, putting a good employee wellness program is the right thing to do. Helping your employees be healthy is the right thing to do, and so we sort of have that as our philosophy. So since 2006, we have expanded quite a bit. We are now reaching out to about two-thirds of our employees. I can't say that we're reaching all of them. And we have in 2008, which is when Jacqui came on board, is when we did expand into the UK and in Ireland. And then she was involved then in our expansion into the Netherlands and Africa the year later. And then last year, we completed our expansion into Latin America and about 18 countries in Eastern Europe. And this year, I'm focusing on our expansion into India. So we're reaching all, sort of three major areas of our business, finding unique challenges in each of them. But today, I think we're going to be focusing most on some of our successes in the EMEA region. So just about our components of our wellness program. These are the usual suspects that you expect to see. Certainly, we strive to provide all of these components in each of the regions that we go, but the details vary according to resources, regulations, culture. The one piece that pulls it all together for us, being that we are a team of three, so Jacqui myself, and then I have another person on my team that sits here in North America who handles the Americas programming on a day-to-day basis. So we have a team of 3, and so we do use a pretty sophisticated wellness web portal that we call healthyyou.healthyq.com. And it is customized, it's really relevant, private, secure, single sign-on application. And it has a pretty sophisticated administrative system that we manage. So we're able to put relevant, local wellness programming on there. We can do, there's an event scheduler, so we can schedule flu jumps and screen events and such through our website. We also house inspirational stories, forms, and policies for our reimbursement programs, and there's a nice health library on there as well. So we use that as our to go, and so all of our communications, whether they be emails, flyers posted, they all drive people to this website so they can get all of their details on there. One of the other aspects of our program is that we try to take advantage of any wellness services that are offered by local health plans, and very often you'll find things that are just sitting there just waiting to be utilized that the company's already paid for, but we just had a framework for doing. So that's definitely one tip to look for if you're looking at extending. So interface with on-site cafeterias, with our health and safety group in terms of ergonomic safety, with our broader HR team in terms of work-life balance issues, which are even broader than just wellness. I mentioned we have a reimbursement plan for physical activity. We also have a subsidy and reimbursement for Weight Watchers, and we also have on-site fitness centers in some of our larger offices. Screenshot of our wellness website, and you can see in the little drop-down box near the date that that's the opportunity for employees to select their location so that they get the most relevant information. And this one is set to Jacqui's site in the day. And a quick link box is the place where people can go and get forms and sign up for events and read inspirational stories, etc. And just a quick note about, I've told you about our kind of component. Now just a quick note about our philosophy. We definitely wanted to have a wide variety of services for employees in as many regions as we could, because we recognize that people are in different stages of change. So those of you who are familiar with the stages of change model, we try to hit each of those stages with our various programming. And our recent focus in terms of communicating and reaching employees to get them engaged is a segmentation concept. I don't know if any of you are familiar with, but basically the idea is that you have various segments within your population that have distinct preferences and how they want to hear about or read about health and wellness opportunities. And so these segments are things like leading way. So that's the people that they're already doing all the right things. You just need to, provide them with the opportunity. There's those that are in it for the fun, that are looking for competition or camaraderie in their wellness opportunities. Those that are value independent, I need plans, the right now folks, and the get through the day folks. So we've recently started to adjust our communications to try to reach out to each of those groups. We were really lacking in our communications reaching out to of them, and we were overdoing our communications for the leading the way and in it for the fun folks, for example. So that's one of the ways that we're trying to adjust and reach out to more folks. And my final slide before I pass it over to Jacqui, just a few thoughts on our expansion strategy in the last 5 to 6 years. None of us are directors, none of us are VPs. People don't have to listen to us, so we feel like we want to make people want to listen to us. And so we don't pass up opportunities to present at meetings with key stakeholders. So compensation and benefits team, which we're a part of, but we always try to make sure that everybody in our group knows what we're doing, why we're doing it, and if they have questions or concerns that they feel comfortable coming to us, so we can help them help us. Certainly local HR, and Jacqui will demonstrate this, that she's really reached out and developed very strong relationships with many folks out there. Facilities, I can't really overstate how important it is to have facilities on your side, as well as safety, security, and local management groups. That's definitely one of our strategies, is to get out there, be seen, keep telling, kind of the story of how we think this is good for the business. And also try, although we're the only 3 full-time wellness employees at Quintiles, we try to encourage people within these critical groups to adopt roles that, really assign wellness implementation as part of their job responsibility or their goals. An ongoing, process that we've made some good connections and have sort of expanded our reach in that way. And that's in addition to the voluntary wellness champions that we are using. And what we find is that the folks that have as part of their role, if you're in facilities and you're already sort of thinking of all of the people office as your responsibility, then expanding on this kind of comes natural. If you're more siloed and you're more, in an operational, functional, scientific part of business, they don't necessarily think that way. And those people do better in sort of championing one certain event that they may be passionate about. But they're not great at, knowing how to communicate with everybody at the office, for example. So kind of knowing what the natural skills are of the people that want to help you is important to help them be successful and not get frustrated. We really have a goal to set reasonable expectations for employees and leaders in each region or country. A couple of years ago, we got our CEO to send out a message at the beginning of the year to everyone in the company. And at that time, we were probably only offering a formal wellness program to about maybe a third of the employees. So there was a lot of anxiety within the HR group that, why are you reaching out to these people that don't have wellness programming and telling them, of the wellness programming? Isn't that kind of risky? You're going to set us up for someone's going to be calling us saying, why don't we have wellness? We still sent out, and what happened is that the countries and the HR folks that were ready to sort of take that next step, they took that next step, and Jacqui will explain in a few minutes that actually was why we now have Eastern Europe kind of under our remit. We have funding for Eastern Europe. It was because they happened, but they wouldn't have made it happen if they hadn't kind of been prompted by the message from our CEO. So taking those sorts of risks is important, and then also kind of knowing how to respond to, what may come back at you either internally with your HR group or from a broader employee base. Part of our strategy is to survey existing wellness benefits. It's very interesting for us to find out that even though we're not supporting this in Europe, there's a lot of wellness going on in Europe. And so just on to that, providing guidance to that, even though we're not officially, funding it or managing funds for it, it's still beneficial to kind of have that holistic view that you can kind of pull together things that are already existing that we didn't necessarily create. And advising your regions and countries for a phased wellness programming. It's taken us 6 years to get where we are now. It's probably going to take us another 6 years to be reaching out to all of our employees. And we have found it, obviously much better around to work with regions that have secured budgets for upcoming years, and that's exactly what happened there in Eastern Europe. So I'm going to let Jacqui then take it from here, and she will be able to give you some more details about what she's been doing in her region.
Thanks, Anne. Well, hello, everybody. Yes, so in the Eastern European region, where this email did go out, we have a very enthusiastic compensation and benefits manager in that region who really didn't accept that we couldn't be happy, we couldn't expand at that time just because of a budget point of view. And because of her enthusiasm, she set about working alongside with me in seeing how we could implement cost or low cost programming in each of her 18 countries in Eastern and Central Europe. What we did was we identified local HR within those countries, somebody that would take it as part of their job role, wanted to take it as part of their role, and we worked with each of those individually to look at the survey results, see what was already happening. And as Anne said, it's very interesting. What we found is sometimes we highlighted actually there was a lot of good things already going on. But what we were able to do was put it all under a wellness umbrella, if you like. And our program, of course, called Healthy Q. We can use that logo. We could anchor everything together. So we say she's passionate about wellness, and I started getting onto their sort of larger regional calls, and their regional head, who's also very passionate about fitness himself, really was a strong proponent too, and really got the budget request going. That was the link to the local HR, who quickly took ownership while being receptive to my guidance, really started to set the path forward. It's really important, we found very quickly, to stick to those core principles and wellness components, as Anne defined earlier, to really keep things together without things wandering too far away from what we're set out to do. Because what one person's perception of wellness is will vary tremendously to it. So we learned not to presume. So an example of this would be in one particular country, in the offices they were getting very dry mouths and sore throats. Into their budget proposal to have air filters, and obviously this wasn't part really as a wellness concept, and it was more and getting health and safety involved, the managing of these filters, making sure the right ordered and maintained. So we had to push back and give the reasons. And there was some confusion initially of what could be used. Also, people were excited to get a budget, and then they didn't really know quite how to spend it, given the components, and so sometimes some unsuitable was made. On the other hand, we could diversify slightly. We have immunisations. Hello.
Yes.
Hello?
Your line's getting a bit muffled at times.
Okay.
You can do just to speak slightly clearer.
Yeah. Okay. Let's see if that happens again. So in other countries, such as Greece, they propose they'd like to have hepatitis C vaccinations in place because that was appropriate in that area, and not all employees had access to that. So that seemed a sensible option to put in place there. So once they'd got the budget request going, they managed to secure a small budget. We had things in place, ready to go. The people identified. We'd got a shared site for documents and articles and newsletters, and now they are already starting to give their participation and periodic metrics to us as a result. So looking at the planning process that we use, cost initiatives are either central or locally driven, and examples of centrally driven initiatives that we've put in place would be our tobacco-free workplace implementation, which we've done in the UK now, South Africa, US and Canada. We've also used this process for implementing a health and wellbeing assessment, which we plan to put in all of our countries. Also implementing the wellness website that Anne talked about, healthyq.com. We also have a centrally driven challenges as well as local challenges, and we're going to look at some examples of those on the next slides. We've also using these global challenges, we can make them simple and reach out to a global audience. And as we also have physical activity reimbursement plan. We're locally driven initiatives, and of course they're more do local using local resources like health screening, flu vaccinations, vendors that are local, and also sort of office based events and community events. We seek out what we're trying to achieve when we are rolling these initiatives, and really understand the product of what we're trying to do with it in the country, and then really explain that and make sure that people are involved, are bought in as well, because once they understand what they can achieve, they're going to get much better results. With stakeholders, it's very important to find out what attributes they have that might reveal barriers as well. And for instance, a very heavy smoker might not necessarily support a tobacco-free workplace, or someone who is overwhelmed with their job may not be able to champion additional benefits, even though they be successful and very good at it in their region or country or office if they could. So in these cases, we find we need to be patient and wait for the right opportunities. So the Global Health and Wellbeing Assessment that we have in place, we have in the US, it's also in Canada, the UK, Ireland, Africa, all 10 countries in Latin America. It's in New Zealand, and this is a screenshot of the Dutch, the homepage in Dutch language. And we're also launching this quarter into 15 of our 18 countries in Eastern and Central Europe. When we first launched Healthy HQ in the UK and Ireland, we used a different provider, actually, that was part of our practice insurance plan. But when that contract came to a natural close, we felt it was a good opportunity then to bring all our countries in together into a global initiative, and this makes it much better and more easily to manage, especially as we still have the same amount of resources, but we're expanding. Made it a good move. So what do we get from the assessment? We are getting semi-annual participation metrics and also annual aggregate metrics, and this is great, a really good flavour of what's happening in that country or region. So measures such as inactivity, stress, poor nutrition, sleep patterns, and also what employees are doing really well, and they can act on that appropriately. So the communication plan and posters can be uniform with just slight regional changes, such as language where available from the vendor and passwords. As I mentioned, the challenges, and here's an example of a challenge made simple for a global audience. Put them back in your time as a global challenge we have running currently. Work-life balance is an issue that occurs throughout every country, and so this challenge resonates globally. With this challenge, employees enter by simply clicking on a link to a survey tool to state what their plans are to bring wellness into their day, and which may involve, of course, talking to their manager to make that possible. What we did, we'd contacted our senior leadership team and our managers. They were informed prior to communications being sent, so they knew what to expect if an employee approached them about it. They then would go on to complete a second survey to tell us how they did, and there'd be a regional prize draw offered to encourage participation. This is very simple to do, minimum adjustment for different countries. And another example here, challenge that would appeal to a global audience. This challenge, Maintain, Don't Gain, was looking for participants to register and start logging their start weight, and then weekly emails were sent, and they would log each week whether they'd lost, gained, or maintained. And this was launched just really around about the Thanksgiving period, over the holiday period, including Christmas time. And so again, this is where wording comes into play, keeping it simple so it's easy to manage. Holiday weight would appeal, rather than sort of returns Christmas holidays, which we'd use in the UK, or Thanksgiving in the States. So it covers all that areas. Use generic icons like the gingerbread man that would appear. And we do actually research all these things before sending them out. Emails, which are very relevant. Now, in this case, my colleague wrote the emails and she bounced them over to me to check them out. And we made simple tweaks, like putting dual measurements so that it really appealed to a global audience, but at the same time, keeping it simple for the good for the administration. See here is a comment, somebody here in the US that really challenge, and they gave us some great feedback. Share great results, share them with the people who are reluctant. Everyone gets motivated with great feedback, whether it's employees or local HR. So, more the planning process. Advertising about keeping things simple, and that is what we've learned. We've learned sometimes we've got more and more complex, and we've had to go back to basics to make sure that we are appealing and it's manageable. An example here would be the tax verbiage, and we have this reimbursement program that Anne mentioned, and although we have to have different forms for countries, we realise that certain things we can make easier ourselves. Taxation is different in every country, so we just made it simple. We now put taxation as per country rules. A lot easier to manage, and we were, I think, trying to please too many people and making it too complex. Selecting the initial countries sounds very, very simple, but sometimes the most logical approach doesn't always happen. We had wanted to go to some of our larger countries next, but as I said, it's really getting buy-in and where you've got the enthusiasm, and of course we've gone to our smaller countries, and often they select themselves. We had this with the Netherlands, which she had wanted to have the reimbursement program. We knew they were very keen. They had the budget ready. There's pros and cons to this, because what we found that although they were keen, they wanted to do it their own way. And while initially we were very accommodating and tried to make that happen, as we've expanded, we've realised that, as a large programme, we need to keep this uniform. So we have pulled back and make sure the offering is as uniform as possible. To the demographics, of course, are very important. Obviously, in the summer campaign, keep you safe in the sun and keep you well hydrated. It's not work with somebody it's in their winter time. And also look at what existing benefits are offered. And Anne had mentioned, there may be benefits there that are not being utilised. And there may be something similar, so it would be, it wouldn't be appropriate to offer. And Anne, I don't know if you wanted to add the experience of Australia there.
Yes, well, early on, we had wanted Australia to be one of our kind of early adopted countries because of, the language and just the lifestyle and everything. It just seemed like sort of an easy fit. But it turned out that they had an existing benefit, which was a lifestyle stipend that basically employees were getting a certain amount of money put into each paycheck that was earmarked for lifestyle. And it was a large amount of money, much more than we were funding, any other country with. So they were very reluctant to give that up, and as it turned out, they really didn't. And so they sort of backed away until we bring Asia as an entire region back in together. We'll sort of readdress that. But although we wanted to include them, it really didn't work out that way because of that pretty significant competing benefit that already existed.
Thanks. And also the locations of your workforce, again, very important in those identified countries. They may be shift workers, they may be factory workers that haven't got access to computers, are they home or field-based. So in the plan, very useful to actually identify that first. And of course, the implementation plan being detailed in terms of timelines as well. We find it's very to work backwards because things can take a lot longer than we initially anticipate, especially if you've got translations to take place and you need people in different countries to test them. Are the communications ready, posters, etc., and passwords. So we have a look at potential pitfalls, and these are all things that actually have happened to Anne and I over the last few years. that we've come across, and some of them are the most smallest things, but they can have a very big impact, and sometimes in the wrong way. So this can particularly happen when you're going out of your headquarters country, where everything reads absolutely right and policies, etc., but are not going to resonate outside of that particular place. So an example here would be just simple things like measurements with our wellness website. Although we have a European version of that website, we found that once the health indicators went in there for our wellness tools, we could identify that the cholesterol and glucose measurements were the that are used in the States, and measures are so different, as it looked like they were 4 times higher than in the UK, and in the rest of Europe. And so it's a simple thing, but it was something that you could easily lose engagement if someone could see that it was not right. It's important as well that we understand those measures ourselves, or we get them checked over what we don't understand. The laws and regulations, of course, vary, and we found this with our tobacco-free definitions when writing policies. In the US, we can make it a statement that employees mustn't smoke within 30 metres or yards from the entryway of the building, whereas in the UK, with the law it is, if 30 metres or yards is outside onto public open land, then of course they can smoke by law. And so we can have to change the wording to such as we respectfully ask that you move away from the entryway. And that's the differences that we have to observe. Frequency values isn't in terms of incentive prizes, and we found that this can make a difference in terms of readiness for uptake if people don't think the values there. Inflation, currency values, people might expect that, but we actually use a standard of living index, so it's very important that people understand why prizes are worked out the way they are. And Anne showed on the website the way we use our date format, and that is something you can come unstuck with, because, for instance, the 3rd of April in the UK is 3-4-12, whereas in the US, of course, that would mean the 4th of March as opposed to the 3rd of April in Europe. So very thing, but something to change. And things such as eligibility, IT issues, such as sign-on, is there good access to get to resources for other regions? Are we reaching employees well? Can they get in front of a computer if they're field-based? Will text messaging work, or live meetings? And the impact of time zones, very important as well. And we have a strong lesson learned when an American vendor was launching a newsletter by email for us, and this is the start of our program, and it came out at 9 o'clock in the UK. But of course, they weren't actually on board about 2 o'clock Washington time. Washington time was 9 o'clock, it was 2 o'clock in the UK, and I was powerless to change anything when a link didn't work. So that's very important as well, and the best time to send your communications out that will still reach Europe, around about 2 o'clock UK time. And we now expect difference in readiness and uptake of various components. We understand that will vary. For instance, we get about a 50% uptake of our reimbursement program in the Netherlands. They really wanted that. They're a young population. They're very active. But challenge is the uptake is very low, and so we don't get despondent with that. No, we know that will vary. And sweet assumptions, we've learned not to make them. Don't assume that feedback from one local person is representative of all in the country. There are more similarities in people across regions in terms of wellness and differences. Most people want information, and they want motivation and recognition. So on that note, I'll hand back over to Anne, who will conclude.
Great. Thanks, Jacqui. So we just have this last slide, and I think that what it might be easiest is to is here and let let's move on to Q&A, because I know we just have 5 or 10 minutes left at. But just to say that I think our biggest lesson learned is just that this is a very long process, very much dependent on relationships, and workplace wellness is a concept in many of the places that we go, and we are in many ways a teacher, and so we have to sort of adopt that philosophy of being patient, of repeating the message, and developing relationships, because as we all know, when it comes to behavior change, you can't just somebody to do it, but you want to help them feel that they want to do it. So we've had to take a step back and kind of adopt that sort of teacher mentality in many ways. So yeah, I think if you can open it up to questions, that'd be great. I do have one question that came in through chat. Should I go ahead and answer that one first?
Sure.
If you have a question, then why don't you read out and then answer it so we can get it going? Yeah, why not?
Okay. So this question is asking me, can I tell you more about how Australia used the lifestyle subsidy to encourage physical activity and health in the population? And actually, that to us was actually a problem, because they really aren't. There's no check and balances to the system. It's simply additionally on each paycheck that is earmarked for lifestyle, but there's no proof of anything that is required. And our concern is that over time, that extra money would just sort of be absorbed into somebody's income, and they wouldn't necessarily be spending it on themselves for wellness. I think the reading population, or maybe the in it for the fun part, they probably are, but there's probably a lot of people who aren't. They need more to help take advantage of that and to really get the message of using that for lifestyle.
Okay. Thanks. Yes, I haven't really heard that before from other companies having a lifestyle bonus, so to say. That's interesting. We have other questions at this point.
Yeah, sorry, the line went and then are you open to questions now?
Yeah. Do you have any at this point typed in, or?
We've got questions typed in so far, but again, if people would like to ask a question, what they can do is use the raise their hand icon, and I can review their question and unmute their line.
Your online portal in-house designed or purchased from a vendor? Purchased from a vendor, and we're on our second vendor now, and we're working with a company called Pure Wellness, which is a U.S.-based company, and we actually are one of their first global companies, so we have gone through that process. They developed 2 sites for us. One that is designed for U.S. and Canada, and then one that's designed for all of Jacqui's regions. And so we kind of worked through all those pitfalls. Having had experience prior to developing these sites, we have worked through all of those pitfalls to work with 2 very distinct sites.
Okay. Other questions?
There is Tracy Barry. How do you measure engagement at any of your sites? Is it mainly participation-based?
Yeah, I think there's actually another question along those same lines. Yes, please, Laquana. Is there an impact of program on employees' health and or business performance, and if so, how? So we definitely do participation metrics. That's certainly the easiest thing that we can do, and we collect. Every 6 months we kind of do that formally, mostly so that we can make adjustments in terms of the quality of our communications or the quality of our various components to kind of compare year over year. I would say that it's called. We get probably, I'm trying to put it into 3 or 4 different buckets. But in terms of website engagement, for example, and monthly, activity on the website, we're probably getting somewhere around between a quarter to a third of our employees being that engaged. But if we let who's log on a yearly basis, then it's obviously much higher because they're logging on to schedule for their screening or something like that. The HRA, or the Health and Wellbeing Assessment participation metrics, very interesting. Wolf had mentioned the enthusiasm in Latin America and in Asia, and in fact we did have incredible. It was over 70% of our employees in Brazil participate in the Health and Wellbeing Assessment, and also pretty high in Argentina, and I'm hoping to see some really good results in India. So we measure, as much as we can through reports from external vendors and our own reports through our anything that people registered through the website. We can get our metrics that way. And in the U.S., where we have a much richer, access to health claims and the such, we are starting to work with CIGNA, who's our provider, to looking at shifts in risk buckets and such. So, like I said, we're not. Luckily, we're not heavily burdened to spend a lot of our energy, proving the return on investment on these things.
There's one more question. I think, Barry, you have it, Dwayne.
Wayne Olson from Deere & Company has asked, who does your translation? Is it CIGNA, especially for your HRA instrument?
Yes. 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 I've been doing nations for Eastern European countries and for Latin America. And what we then do is send them out to the country representatives to check that they're resonating with them.
Maybe I have 59. Can we get the EAP just quickly? And maybe, have you got experience with EAP services offered in Latin America as part of your wellness programs?
That's a really good question. So we have a dedicated benefits person in Latin America who just started last year, and I am not really bubbled up in terms of, I don't think that we have a full regional EAP program down there. So I think that's one of the things we're kind of looking for right now. Sorry, very good information.
Well, I think we need to wrap it up. I know you've got other stuff to do too. So if you have any follow-up questions, as usual, please send them to us or directly to the speakers, also regarding to the benchmarking study. So I thought it was a good session. I'd like to thank everybody again for joining us, and as usual, provide us with your feedback and for future sessions. So we'd love to hear that and react to that too. Next one will be in late March or early April, just so you know, but as usual, you'll be receiving communications on that. And an announcement in terms of an event, the Global Symposium of the International Association of Worksite Health Promotion in late March on the 27th in Las Vegas, especially for those of you in the US, that may be an interesting event. It's a one event, so it's actually not too long. So thank you very much again to both Anne and Jacqui. I thought it was a great presentation, and thanks to everybody for joining. And I look forward to speaking to you and hearing from you next time. Thanks up and goodbye.